Now, Professor Weber, we are coming to the food disorders occurring mainly in adults as a consequence of diabetes mellitus.
Diabetes mellitus is a chronic metabolic disease affecting millions of people worldwide. Among its many complications, food disorders are some of the most serious and potentially devastating problems. Diabetic food disorders refer to a spectrum of pathological conditions that affect the feet of individuals with diabetes, ranging from mild skin changes to severe infections and even amputations.
Professor Weber, why does diabetes affect the feet?
The risk of developing diabetic foot disorders is linked to two principal diabetes-related complications. Number one, neuropathy, and number two, peripheral arterial disease. According to the neuropathy, chronic high blood sugar damages the peripheral nerves, particularly in the legs and feet. This condition, known as diabetic peripheral neuropathy, reduces the sensation, making it difficult to feel pain, heat, or injuries. Minor injuries may go unnoticed and untreated, leading to more severe problems. The peripheral arterial disease due to diabetes accelerates atherosclerosis, the build-up of plaques in the arteries, which decreases blood flow to the extremities. Poor circulation impairs wound healing and increases the risk of infection. Therefore, the combination of neuropathy and peripheral arterial disease creates a dangerous environment where small injuries, blisters, or ulcers can rapidly escalate into severe infections or gangrene. Gangrene meaning the death of tissue.
Professor Weber, what are the common diabetic food disorders?
Diabetic food disorders comprise a wide range of conditions, including and not limited to diabetic food ulcers, means open sores or wounds often on the bottom of the foot that are slow to heal due to poor blood flow and blood supply and reduced sensation. Also infections, bacterial, sometimes fungal infections can develop in ulcers or wounds, leading to cellulitis, abscesses, or even bone infection, called osteomyelitis. Charcot food, a rare but serious condition characterized by weakening of the bones in the foot, often leading to fractures, dislocations, and deformity. The foot becomes swollen, red, and warm, and its shape may change over time. Gangrene, that means tissue death due to loss of blood supply, usually requires urgent, immediate intervention and possibly sometimes amputation. Calluses and corns, these are thickened area of the skin resulting from repeated pressure or friction. These can break down and turn into ulcers if not properly managed. Dry skin and cracks. Diabetes can reduce sweating and oil production in the feet, leading to dry, cracked skin that increases the infection risk. Amputation. In severe cases where infection or tissue leads to death of the tissue cannot be controlled, partial or full amputation of the foot or the leg may be necessary to save the patient's life.
Dr. Weber, what are the signs and symptoms of a diabetic food disorder?
Prompt recognition of diabetic food problems is crucial. Symptoms may include swelling, redness or warmth in the foot, non-healing scores, blisters or wounds, drainage or pus from an ulcer, foul odor, pain or discomfort, change in the foot shape, black or blue discoloration of the skin indicating poor blood flow.
Professor Weber, how can you diagnose a diabetic food disorder?
Effective management of diabetic food disorder begin with accurate and timely diagnosis. Assessment include clinical examination, imaging like X-ray, MRI, CT scan, vascular assessment like Doppler ultrasound or other techniques, laboratory tests like the blood test, infection markers, blood sugar control, and so on.